confirms first Mpox case in traveler who returned from country experiencing virus transmission. The Indian government on Monday, September 9, confirmed the first case of Mpox, monkeypox, in the country, stating that the lab tests showed the presence of the Mpox virus of the West African clade 2 in the patient. The Ministry of Health and Family Welfare said the case was an isolated one and not part of the current public health emergency declared by the World Health Organization, WHO. This case is an isolated case, similar to the earlier 30 cases reported in India from July 2022 onwards, and is not a part of the current public health emergency, reported by WHO, which is regarding clade 1 of Mpox, the ministry stated in a release. The individual, a young male who recently traveled from a country experiencing ongoing Mpox transmission, is currently isolated at a designated tertiary care isolation facility. The patient remains clinically stable and is without any systemic illness or comorbidities. The ministry added that contact tracing and monitoring were actively in place to ensure that the situation was contained. There is no indication of any widespread risk to the public at this time, the ministry declared. Notably, following the WHO's global alert, the Health Ministry adopted the following recommendations from the National Center for Disease Control, NCDC. Heightened surveillance at entry points, identification and isolation of suspected and confirmed cases, laboratory testing, community awareness efforts, infection control measures in hospitals. What is Mpox? Mpox is a viral disease caused by the monkeypox virus. It was declared a public health emergency of international concern by WHO on August 14, 2024, for the second time in 2 years, the first being in 2022 when cases began spreading globally. Democratic Republic of Congo has been the epicenter of the crisis. Up until this month, more than 18,000 suspected cases of Mpox, including 629 deaths, have been reported in the African nation. 4 out of 5 deaths have been in children. According to the United Nations Children's Fund, UNICEF, despite issuing an emergency tender to secure vaccines, it could take several months for the actual rollout. WHO is reviewing the information submitted by the vaccine manufacturers on August 23 and is expected to complete its review for emergency use listing by mid-September.